Good afternoon, everyone. My name is Dr. ELMA VARGHESE. I'm a junior resident in GMC Kozhikode. Today, I'm going to present a case of myelin oligodendrocyte glycoprotein optic neuritis. So, a 23-year-old male presented in our casualty with sudden onset defective vision in left eye for 2 days. He also had associated pain on left eye movements. He had history of similar illness in the right eye. First episode in 2012 and second episode in 2017, for which he was treated with IV methylprednisolone followed by oral prednisolone, and his vision improved. There's no history of any associated comorbidities. On examination, his general examination and systemic examination were within normal limits. Ocular examination, right eye anterior segment were within normal limits, except pupil direct reflex was brisk and consensual was sluggish. Best corrected visual acuity of right eye was 6/6. Left eye showed grade 3 RAPD with best corrected visual acuity of perception of light with PR accurate. This is a fundus picture of the right eye, which shows the media was clear, the disc margins were defined, the cup disc ratio of 0.3, and there was a temporal pallor. The vessels and peripapillary area were normal. This is a fundus picture of the left eye, showing again media was clear, the disc margins were defined, temporal pallor were there, vessels and peripapillary area was normal. So after obtaining this history and a clinical examination, we came to a provisional diagnosis of retrobulbar neuritis left eye and recurrent optic neuritis right eye. We kept the differential diagnosis as multiple sclerosis, NMO spectrum disorders, and MOG associated disorder. Investigations. Routine investigations were within normal limits. MRI brain was done, which came out to be normal. There were no evidence of optic nerve enhancement. VEP showed reduced amplitude in both eyes. Serum MOG and NMO was done, out of which MOG IgG came out to be positive. This is a OCT imaging of the right eye showing thinning in the temporal neuroretinal rim. This is a OCT of the left eye showing thinning in the temporal neuroretinal rim. So after that, we came to a final diagnosis of MOG positive optic neuritis. Patient was given intravenous methylprednisolone therapy, 500 milligrams BD for 3 days, which was followed by tapering doses of prednisolone. Neurology consultation was sent in view of serum MOG positivity, and patient was given 2 doses of rituximab injection and is now regular follow-up now. Vision in left eye showed significant improvement to 5-meter counting fingers from perception of light. Discussion. The phenotype of MOG associated disorder is broad. It includes optic neuritis, transverse myelitis, acute demyelinating encephalomyelitis, brainstem encephalitis. Optic neuritis is the most common presentation in adults, whereas ADEM is the most common presentation in children. Clinical characteristics suggestive of MOG IgG optic neuritis include recurrent optic neuritis, prominent disc edema, perineural enhancement of the optic nerve on MRI. Initial presentation of the patients with NMO and MOG is similar. Diagnostic evaluation in patients with acute optic neuritis should include assays for both NMO and MOG IgG antibodies. MOG optic neuritis respond well to steroid, unlike NMO SD optic neuritis. Some develop a condition called chronic relapsing inflammatory optic neuritis, characterized by recurrent episodes of steroid-sensitive optic neuritis. Therefore, in patients with presumed chronic relapsing inflammatory optic neuritis, an assay for MOG antibody should be performed if not done already. Role of immunosuppression in MOG optic neuritis. Sometimes it can present as a monophasic illness. In such cases, chronic immunosuppression may not be required. If disease recurs or present with other neurological manifestation, acute treatment with steroid and chronic immunosuppression should be considered. Thank you.
Very nice. Since we had quite a bit of discussion on MOG and optic neuritis, so you actually nicely summarized and you summed up everything which happened in the previous 3 cases.